When I first walk in to meet a patient and their family, I make sure that I communicate very clearly, compassionately, honestly. I really want them to understand that I'm going to treat their child as my very own. And that's the truth. I have 3 daughters, and I am going to treat your son or daughter just like my own child. My father is an obstetrician gynecologist, and I got to walk around the hospital with him as a little kid and got to observe what kind of a day-to-day life was with a physician. When I did get to college, I really felt strongly that this would be the path that I would take. But ultimately, I knew that I love pediatrics. I love children. They keep us humble, and they're very resilient. And then I made it to hematology oncology a few months into my residency. So it was a combination of the science that was really interesting to me, as well as the patients. The great thing about the relationship that a hematologist-oncologist develops with their patient is that we almost become like their primary care providers from the beginning of the diagnosis until through treatment and even beyond when we continue to follow them afterwards. We guide them through the most difficult time of their lives, of their parents' lives, and so we become very close. Very important part of it is to listen, to allow them to ask questions and to really tell them that it's okay. That's my job here. My job is not only to make the right diagnosis and choose the right treatment protocol, manage the side effects, but it's also to educate, to make sure that you feel heard, that you are heard, and that I answer the questions and educate the child and their family so that they feel empowered. Because if they understand what's going on to the best of their ability, then they will feel like they are taking part in the care of their child and allow them to really be a partner in the care. This is a care that is so complex that it requires really the expertise of numerous people. And I'm very fortunate to be in a place where those teams work really well together. And when I get to follow my patients sometimes, they keep in touch with me and I get to watch that they graduated college, see them have children even. It is just so rewarding to know that, I was a small part of getting them to that point.